Are your operations reliable? Are they consistent and repeatable? Think about other out-of-industry brands that make us feel safe, that we trust. They have a lot of reliability. Competence, obviously, with our clinical care and making sure every professional, whether they're frontline or clinical team, is skilled up to the highest degree for their role. And then the warmth piece, it's all there. So that whole safety, quality, experience, three-legged stool is represented in those drivers of trust.
Hello and welcome. I'm Chris Malone, and I'll be your host for today's discussion. Thank you for joining us. I'm also pleased to welcome our friend, colleague, and program partner, Stephanie Admiral-Yuan, to the program. Stephanie is a Vice President of Engagement at Plaintree, which is a global not-for-profit organization dedicated to humanizing healthcare for everyone through excellence in person-centered care. Welcome, Stephanie. Please tell us about today's guest.
Thank you so much, Chris. It's great to be here. And it's absolutely my pleasure to introduce our guest today, Jennifer Barron, who is Chief Experience Officer at NRC Health. In fact, Jennifer is the first CXO, as I understand it, in the history of the company, which, as I'm guessing most of our listeners will know, is dedicated to helping healthcare organizations everywhere understand and improve the experiences of those many stakeholders in the healthcare journey. Jennifer works closely with NRC Health's client partners to reimagine the human experience in healthcare and to connect patient and provider experiences to advance healthcare for all. Jennifer's career has been more than 30 years in healthcare. Before joining NRC Health in 2024, she held a number of leadership roles focused on patient experience, including Chief Experience Officer at UC Davis Health, which we were just talking about, and Executive Director of Experience Design at Indiana University Health. She holds a degree in communications from Ball State University and is a certified patient experience professional, or CPXP. Recently, I have to say this, I'm sorry to embarrass you, but I want to celebrate with you. Jennifer was recognized as one of the top 50 women chief experience officers of 2025 by Women We Admire. I love that. And it's an absolute honor to welcome you to the Humanizing Healthcare podcast. Back to you, Chris.
Thank you so much, Stephanie. Welcome, Jennifer.
Thank you, Stephanie. Thanks for the great intro. I appreciate it. And I am honored by the recognition that I received this year. It's humbling.
So, Jennifer, I was wondering if you could share the story or experiences that led you to choose a career in healthcare. Is there anything in particular that led to that you could share with us?
There are so many people, Chris, that I'm sure you have talked to and I have talked to that have these amazing stories about how they got into healthcare. And my story is really pretty simple. I simply needed a job. When I graduated from college, it was a tough job market. I happened to find an opportunity at Indiana University Health. It was before it was IU Health, in their patient contact center. And they needed somebody to help develop that patient contact center. And I was so intrigued by that role because I got to talk to not only patients, but also to healthcare providers, to their office staff. I really got to navigate through the entire health system to help people get access, that I found myself wanting to learn more. It wasn't until a few years later in my first patient experience role, however, that I really discovered, I would say, my true purpose or passion in healthcare. And it was actually, again, at IU Health at the Children's Hospital there, Riley Children's Hospital. I had an opportunity to lead a project there and was a partner in developing the first patient family advisory council there and patient family as advisors. So or as faculty, I met so many wonderful family members and patients, and I had a young child myself, and I recall one of the mothers saying, it isn't very often that you're at the station when the train to heaven comes and gets your child. And I was so moved by her ability to engage with healthcare providers to help alleviate suffering of others because she had suffered through the experience of a loss of a child, that I thought, I've got to lean in here. I've got to get more involved for my family, for my friends, and just for the greater good. And that really sparked what has been an amazing career journey for me.
Well, it's really a great example of how healthcare providers and caregivers are not just treating the physical aspects of care, that it's the emotional trauma and needs that have to be addressed as well. It's such a great lead in to what we're going to talk about today. So congratulations also on being named the first Chief Experience Officer for NRC Health. I'm really curious as to what led to the creation of that role and what kind of things they have you working on as a result.
Yeah, sure. So our senior leadership team, I think, smartly recognized the importance of mirroring the key CXO role. NRC Health, as Stephanie mentioned in the introduction, has been in this space for many, many decades, working with healthcare systems across the country to improve human understanding and patient experiences. And they had kind of lived the journey of the evolution of the CXO role, which has really grown over the past decade, and saw the effectiveness of that role in the many healthcare partner organizations that we work with. So they wanted to mirror that. We are working very hard on evolving and really kind of next leveling our human understanding footprint, as well as deepening our experience management offering. And so they really wanted somebody who had walked in the shoes of a CXO, who had walked alongside other executives in really this work and in building strategies and executing tactics around this work. And I was lucky enough to land in the role. I'd worked with NRC Health for a long time and was very familiar and excited about coming on board. My role specifically, I lead the strategic direction of our thought leadership and advisory services. So we provide all of our written content, our speaking engagements, our workshops and toolkits. We've developed several assessments, both strategic and tactical, that we're able to use to support our client partners. And then I also work across the teams within NRC Health, providing advice and partnership in key projects and initiatives that we have.
Well, that's a really smart decision, I think, because you have a unique background, both your time at IU Health and UC Davis Health as well, to know what chief experience officers need and what is most actionable for them. So leading the thought leadership and content and programming on all of that, I think is really, well-designed approach. Now, speaking of that thought leadership work, you recently co-authored one of NRC's 2025 Experience Perspectives research report, which highlights a number of notable, discoveries and insights and so forth. And one of the key themes in that report is the evolution and importance of trust in healthcare. And I was wondering if we could kind of kick things off and have you tell us more about that in particular from the report.
Yeah, I would love to. I, again, co-authored is, I think, an important term because there were actually 8 of us that authored that particular piece. We have an outstanding thought leadership team with experts in many different areas. And we became really interested in trust, not because it's new to healthcare. I mean, trust has been a tenet of healthcare for decades, at least as long as I've been in it. And we touch on that a little bit in the paper and how our conversation around trust has evolved through the history of healthcare. But trust in and of itself is a fundamental human emotion. And you know this, you and I have talked before. You've done a lot of research in social science and kind of what drives trust in all of us. And it's very, very complex. It's a feeling, it's a cognitive response. It impacts our behaviors, the decisions that we make. Oftentimes, it's so nuanced that we don't even realize when we're being driven by trust. So we actually started getting requests from several of our partners last spring, asking what research we had available to help them focus their work in to rebuild trust after the pandemic. I think we all recognize that trust was at risk during the pandemic. We could see in our post-survey response rates across the country that we did lose a certain measure of trust from both our patients and our workforce during the pandemic. And smartly, again, healthcare leaders were stepping in and saying, we know we need to do something. There's a lot we could work on. Trust is complex. It can often feel nebulous. what can you tell us about how we should actually action on trust? So that started many, many months of research, different types of research. We started with broad national market research through Market Insights, our syndicated market research arm. And we identified the 3 drivers of trust, which turned out to be reliability, competence, and respect. No big surprise. We started having conversation last summer and last fall, actually, after I came on board. We started having conversation with our partners around those key drivers and getting their thoughts around how are you actioning on these 3 drivers? And what we heard back was they're still a little high level. Reliability, what does that really mean? How do I action on reliability or competence? So we went back out, we did some additional research, and we discovered some tenets for each one of those drivers of trust. So, for example, the tenets for reliability mostly revolve around access, ease of access. How easy is it for me to get an appointment? And can I get an appointment through the channel in which I prefer to receive the care, whether that be virtual, in person, whatever the situation. And then the third tenet for reliability is more about consistency across the healthcare journey. And we have all been working on this, again, for decades. And we often call it transitions of care, but it's in those handoffs that we tend to lose people or drop people. And what we heard was, we will trust you more if we can tell you're working together as a team to hold us across an entire journey. So that created more actioning around reliability. For competence, what we learned, no big surprises here. It's about the skill of your providers, but not only the skill of your providers, it's also about the skill of your entire team. So your registration staff, your food and nutrition services folks, your billing people, and your billing process. So how competent are you from end to end on that journey? And then we also saw some signals about safety and quality. Do I feel safe in your environment? Think about hand washing campaigns as an example of that. And this is a good example I like to use because I have been in healthcare a long time. I've had lots of conversations over the course of the decades around people washing their hands. And typically within a health system, we lean into our teams by talking about it being a good safety protocol for our teams. It protects our teams from viruses and different things that can occur. But flip the switch on that a little bit. And if we start also thinking about hand washing as a signal to our patients and their family members about how competent we are clinically, it engages us a little differently in thinking about that hand washing campaign, because it not only protects us, but it also provides security for the people that we're serving from a competence standpoint. So there are lots of little nuances within competency as well. And finally, the third driver of respect is all about the relationship. I think in a lot of your work, you call it warmth. And I love that term, warmth and competence, but it is kind of the warmth part of that relationship. Are you spending time getting to know me? Do you understand what matters to me, not just what is the matter to me? Are you leaning into that? Are we partnering on my care plan? So all of those types of sort of interpersonal pieces fall within the respect domain. And one of the key pieces of that we heard was leaning in to diversity, equity, and inclusion is still very important for the large masses, particularly with some of our younger healthcare consumers. With that part of our research in particular, that's a really important piece of respect.
Yeah, well, you touched on so many important things that I want to revisit. One, that trust has been challenged, certainly during the pandemic, and I think it will continue to be challenged. The fact that we are now receiving information from so many different sources in so many different ways, I think that we will always need to be continually building and reinforcing trust because there will always be new challenges. It may have in the past been that primarily our personal experience was driving that, but we're influenced by many other things now. And you touched on a number of them, right? the systems, policies, processes, all the things that we encounter are giving us information about the intentions and abilities of the care providers we're working with. There was a phrase that I was taught when I was at Coca-Cola many years ago, and I think it is really, really applicable to patient experience, and that is the phrase, everything communicates, right? Everything we say and don't say, everything we do and don't do, everything we see and don't see communicates something about the intentions and abilities of the people that we're interacting with. And so you kind of highlighted that will always need to be something that we address. And then lastly, that, the human part of it. Yes, there's all of the clinical, medical, competence, reliability part of it, but the human relationship part of it is never going to go away, certainly not in our lifetime. And so I just can't help, but react to so many of the things that you mentioned there.
Oh, love it. Yes, thank you. And it's so true. And I think if you really think about those key drivers, they really do cover operations, which you can think about that as, are your operations reliable? Are they consistent and repeatable? Think about other out of industry brands that make us feel safe, that we trust. They have a lot of reliability. No matter where you go, there are some golden threads of their brand weaving through all of their operations. Competence, obviously, with our clinical care, and again, making sure every professional, whether they're frontline or clinical team, is skilled up to the highest degree for their role. And then the warmth piece, the relationship piece, so that behavioral component, it's all there. Everything, it's all there. So that whole safety, quality, experience kind of three-legged stool is represented in those drivers of trust.
Great. Another theme in the report that I found really interesting was this rapid demographic and generational shift that's underway in the United States and how that will impact healthcare providers. I was wondering if you could tell us more about that one. It's a really different and interesting insight.
When we did the initial research on drivers of trust, we actually started filtering by generational cohort, and not to label folks, because we know that everyone in a specific cohort group doesn't necessarily completely fall in with a public definition of that, but really to look at those large trends across these different age-based generational groups to understand, do we see different preferences or expectations when it comes to experiences? What was really interesting is that, yes, we do see some differences. We see a lot of commonalities. But the reality that we are dealing with in healthcare is that we are serving multiple generations of people. We always have been, because one thing is true and will always be true, and that is we will continue to age. And you always have new generations with different philosophies and preferences that kind of come to the table. I think the big driver of that in our modern times is obviously the advent of technology. And it is creating a rate of change that is faster than anything we have ever seen before. So we have, by 2030, CMS is expecting that the over 65 population will be around 71 million people. What's interesting about that CMS report is that they're saying that that group consumes about 40% of our healthcare in this country. So we know that that group is going to continue to grow as we move forward. However, one thing that is true is our younger generations won't quit aging either. And so we'll have 71 million people, 65 or over, as boomers and Gen X combined. And we'll be serving 83 million millennials. And behind that are the Gen Z, our youngest healthcare consumers now, which right now there are around 73 million Gen Z. Now, some of them haven't aged into becoming healthcare consumers, but folks in their mid to late 20s are in the Gen Z category and are starting to become healthcare consumers themselves. So when you think about that, you begin to recognize that we're serving people, a swath of our folks are more experienced in life and grew up in a very analog point in time. When they started consuming healthcare, they did so in a very analog way. And that created a certain level of comfort in the way that you lean into trust, right? In relationships based on that point in time. Not saying a lot of people haven't evolved, because we know Boomers have high utilization rate for our electronic health records, and even mobile phone usage is almost 50% with that group from our research. However, when you get to younger millennials and Gen Z, this is the population that never, ever has lived in a world that has not been digital first. They have no context of what it's like to spend time in an analog world, consuming goods and services in an analog way. And so the big challenge right now in healthcare is that we do have to meet those diverse expectations of the traditionalist, of someone who does have a preference for digital first. And then we have kind of these people in the middle who are sort of bridging it, who can be agile in kind of going back and forth between digital and traditional preferences based on whatever's happening. It creates some unique challenges because we have to get the digital evolution correct. We have to time it in a way where it doesn't leave our traditional preference people behind or put them at risk because they aren't able to engage via technology. My parents are 85, and I would say they're kind of at this stage where my sister and I are helping, but it is wildly challenging, and they are consuming more healthcare than ever. But we still have to meet the needs of those youngest healthcare consumers who have more options available, who could make different choices than perhaps what the rest of us have made in our healthcare consumer journeys.
Yeah, I think we are all kind of living it, right? I've got three sons in their 20s who have a very different, experience of healthcare than I do. And I think it just speaks to, what has always been true, but is perhaps even more increasingly true. And that is we can't have a one size fits all approach to care. That there are always been very different needs and expectations, and the generational differences, particularly around technology, are a great illustration of that.
Absolutely. And I think our clinical teams, clinical providers, physicians, nurses, and so forth have felt this probably for their whole career, recognizing that, they're all day long seeing people with different preferences, different communication styles, having to adapt to that. Technology is kind of throwing a whole new piece of that on the table and probably turning up the volume on the need for agility so that we can best respond to that. And our workforce, we did a workforce study back in the fall because we also wanted to understand trust at the workforce level, not just with consumers and patients, but how is this need for trust and the evolution of trust impacting our workforce? And it is. And we've heard from many of our partners that we also have more experienced professionals who began working in a more analog environment, who are more comfortable with in-person meetings, for example, or receiving communication in a specific way. And then we have our youngest members of the workforce, many of whom just say, you know what, put an app on my phone, send me a text, just give me the information I need and I'll go. And it's a very different way of engaging with each other across our teams. And so we also have to be smart internally and in thinking intentionally about the experiences that members of our workforce are having and how we manage that as well.
Yeah. Now, over the past few years, right to your point, it seems that there's kind of been this growing interest in the idea that healthcare needs to remain or become more human. But NRC Health has been focusing on deepening human understanding in healthcare since 2015.
Mm-hmm.
Now, kind of 10 years later, is this still a key focus for NRC now that the rest of the patient experience world seems to have come to a similar conclusion?
Of course. I mean, I think that the journey is not over. NRC Health actually was in the business of human understanding before we brought that to market in a very visible way. If it started, it was some early work with the pickers who identified the 8 dimensions of care, some great research that was done back in the 80s. And that has been the solid foundation for NRC Health and leaning into this relationship between care that's safe, care that's high quality, and care that is respectful of the human being that's receiving it. And I think as we have moved forward, we're, I talked about us expanding our human understanding footprint. We are getting more and more involved in really understanding how this then impacts our workforce, which I think is also a very timely and important point of view for human understanding in this day and age.
Absolutely. Now, as a mentor and leader to up and coming healthcare executives during your career, what advice would you give to some that might aspire to become a chief experience officer like yourself? It's the role has evolved over time, I'm sure, as you've seen, but are there any rules of thumb or priorities or watch outs that you would offer to those that might aspire to similar responsibilities?
Well, in the conversations that I have had with folks, the advice that I have been given is get involved in projects that allow you to see the many different angles of healthcare, points of view of your operational teams, points of view of your clinical teams. Obviously, I think all of us as human beings at some point in time walk in the shoes of a patient. So bringing those personal experiences or that lens is also important. But I would say it's not a linear path. In fact, I don't know anyone in a current CXO role that said, I'm going to school to become a CXO, and that's absolutely what I'm going to do. And here's the path you take. So people come from all different backgrounds. For me, what was most important was that I had opportunities not only to work in this space, but also to work in operations, to understand the complexities of actually delivering reliable experiences to people. It's so much harder than what you think on the receiving end to get that right. And so really looking for opportunities to lean in to better understand the intricacies of that, to get involved in other projects that may allow you the ability to be a facilitator for some training within your organization. Maybe you're not actually on the team, but you actually can facilitate the content. Many organizations have people from all over. So just looking for those opportunities to kind of build a very well-rounded perspective of healthcare and the many different people involved in delivering a great experience is the most solid foundation that you can have. The CPXP certification, which I went through the certification process in 2019, and I'd been in this work a long, long time. I learned a lot just by going through that particular process. So I always recommend that as well, because it's great at helping you understand your natural strengths in the area and your natural weaknesses. And you can kind of cover off maybe some areas that you haven't had actual active opportunity to be involved with. So that's my advice.
You mentioned a number of things, and I can see, in your remarks, some of what I've seen in others that we've interviewed. First, being a great communicator, that explaining and speaking to a wide and diverse range of different audiences and helping kind of carry the patient experience, insights, and message, but also kind of being an influencer and a facilitator and a coach and an advisor. It seems like a role that people wear very many different hats.
Yes, it is. And I would say the early days of patient experience professionals were about those professionals and teams going in where there's a targeted problem, fixing the problem, shaking the hands of the leader in that area and walking away going, that was great. We've got that fixed. Again, the complexity is off the charts right now, and that's no longer enough. And so I think the role of CXOs and other patient experience professionals, anyone who's leaning into this work, is really also equally about teaching others in the organization and other roles how to think through an experience, through the human experience mindset, kind of see the work through that lens. And so that's becoming a more important part of the role, is that influencing piece, if you want to call it that. I call it teaching others how to do the work, but I think that is more and more important and will become so, because we're going to need an all hands on deck as healthcare continues to transform.
No question about it. Let's take a few questions from our listeners. We have a question from a longtime listener, Ilan Geva. He asked, how does current healthcare politics and government management affect whether it's hurting or contributing to all the great things that you are talking about today? Any thoughts on that question?
Oh my goodness. Well, I don't want to get into too many details there because that's always challenging. But obviously, those types of things impact everything in healthcare. I think, in particular, a lot of the things that are occurring now, we're talking to a lot of healthcare leaders who are obviously very concerned about margins. And coming out of the pandemic, a lot of the political conversations that are occurring, the legislation that is on the table is creating some concern. And I think, yes, we have to be mindful about all of those things occurring. At the end of the day, the other kind of piece of that that's sort of coming together with all of that is the fact that healthcare consumers are more and more and more willing to divert care, to look for alternate channels to receive care. And that all can impact, again, our margins as well. So, in many ways, if we're really focused on that and sustaining viable healthcare systems as we move into the future, we have to understand our healthcare consumers and we have to make sure we're meeting the needs of the consumers so that they are choosing our local health systems and not choosing an alternate path.
Yeah, good points. And, like everything else in healthcare, change creates uncertainty, and this is, just added to the list of changes. Here we've got another question. Does technology dependence influence the development of caregiver-patient communication and trust? More specifically, how do caregivers perceive trust building with their patients?
That's a really interesting one. And in the last couple of years, we have seen more and more health systems lean into ambient listening, particularly in medical practices. I think initially, my perspective on that had from a lot of the providers, physicians that I had talked to, was there was some reluctance balanced with a high level of hope. Because I think the upside of ambient listening is that it removes that screen that has been a barrier for patient provider communication and relationship building for a long, long time. And so once you employ a technology such as that, it allows the physician to come out from behind the screen to actually interact in more relationship-based ways with patients, and for patients to feel more trust building and perhaps even be more open in the conversation. I know the last appointment that I had several months ago was the first time that I noticed my provider actually kind of sitting on the stool out from behind that screen. And the level of engagement and interaction was just so much better just because of that one thing. So I think there's still a little bit of a wait and see, but the high hope for technology is that it will alleviate a lot of the administrative burden that has been introduced in the past several decades and allow clinicians to get back to why they really got into the business, and that is to take care of that human being that's sitting across from them.
The last two sentences is exactly, I think, the most important thing you said. That to the extent that we can use technology to reduce the administrative burden, which is the number one thing that we hear from clinicians, and give them the time and the opportunity to connect and form those relationships with patients that both the patient want and the clinician wants. That's just as you said, many of them came to healthcare to have that connection with the patient and feel like they're making a difference in their life.
Right.
So it's a great,
and patients
point.
Want that equally.
Exactly.
So, yeah.
Exactly. So I got just one final question for you. It's always our favorite final question, and that is, do you have a favorite quote you can share? And if so, why is it your favorite quote?
I like that one. I do have a favorite quote. I love quotes. My favorite is actually part of a poem, a larger poem by philosopher and poet Khalil Gibran. And the line of that poem that I love so much is, "Work is love made visible." And I probably don't have to explain why it's my favorite. I think if you begin to put that in the forefront of your mind every day as you're navigating through all the different experiences you're having as you're going throughout your workday, it helps you to challenge yourself to think about, how do I show up with this person or these people that I'm interacting with through the lens of love? And your interactions are better. Your purpose, you're connected more highly to your purpose. So I absolutely love it. I have the whole poem on my wall. Everyone who has worked closely with me knows that that poem is very meaningful to me.
Well, that one's an awesome one, and I look forward to adding that to our list of favorite quotes as well. Jennifer, this has been a really great conversation. I can't thank you enough for sharing your perspective with us today. It's clear the work that you are doing is driven by a profound understanding of trust in healthcare, and your commitment to evolving industry towards more empathetic and connected care is really inspiring. So thank you so much for joining us. To our listeners, thank you for tuning in as well. Hope you found this discussion as informative and inspiring as I have. And be sure to join us for our next episode of Humanizing Healthcare. We'll be talking to Susan Ryan, CEO of the Center for Innovation in Elder Care. It's another conversation you won't want to miss. Thanks very much, everyone, and have a great rest of your day.